Hello, my name is Karen Rice and I'm a physical therapist with Orthopedics Northwest. Today we will review how to perform the exercises you'll be doing following your knee replacement. I'd like to review some basic information before we get started. As with any exercise program, follow your physician's advice and modify as needed if your physician has given you any directions that are different from what we're about to describe. The exercises should be performed 3 times per day, starting with about 10 repetitions each and increasing as tolerated. You may be able to increase some of the exercises earlier than others, and this is fine. Remember to listen to your body and increase only when you feel ready. Also, it's usually best to allow the leg to come to room temperature prior to doing your exercises, so you may want to remove the icing about 30 minutes before. It's helpful to reapply the ice after your exercises to reduce pain and swelling. Also, don't forget to spend plenty of time elevating the leg following your surgery to reduce swelling, which is normal. To truly elevate your leg, you should have your foot above the level of your heart. This can be done easily by using 3 pillows and making sure that your upper body is lying flat. Following the exercises, I'll show you what that looks like. Each person is different in the amount of elevation time that's necessary, as some people tend to get swelling in their legs during normal circumstances, so after surgery, that's just intensified. So if you notice additional swelling in your leg, it could be that you aren't elevating enough. In that case, spend more time in elevation or maybe get the leg a little bit higher, or both. If that doesn't result in decreased swelling, you can contact your doctor for further assistance. So let's get started. The first exercise we're going to do are the ankle pumps. These can be performed lying down or sitting, whichever you prefer. This exercise may seem simple, but it's an important one to help prevent blood clots and also to keep the ankles limber and loose following surgery. Immediately after surgery, as we lie in bed a greater amount of time and walk with short, shallow steps, our heel cords and ankle joints can get tight. Remember to move fully through the motion, stretching in both directions as you perform this exercise. Toes all the way up and then pointed all the way down. Also, make sure you do this exercise with both legs. The next exercise is the quad and glute sets. You will lie on your back on a bed or couch with your legs straight. First, straighten your knees, pushing the backs of your knee down toward the bed by tightening the muscles on top of your thighs. Next, squeeze the muscles of your buttocks, which will cause your hips to fully straighten. Hold this tightening for about 5 seconds, then relax. Repeat again, starting with the knees pushing down, then the hips straightening. If you're on a very soft surface, you can place a small towel roll under your ankle to help you fully straighten the knee during this exercise, which is very important during the healing process after your knee replacement. If you have difficulty doing the 2 steps of this exercise together, you can do them separately, but most people are able to perform them together. The next exercise is a short arc quad. Still lying on your back, place a roll under the knee that is approximately 6 to 8 inches in diameter, such as a coffee can, a rolled up pillow, or a towel roll. Though it is placed under the knee, you might find that it's more comfortable if you edge it up slightly towards the thigh. Lift your foot off of the bed, straightening your knee as much as possible. Pause for a second or 2, then slowly lower the foot back down to the starting position. Do not lift your thigh up off the roll while performing this exercise. If it is too difficult in the beginning, you can have someone help you lift the leg until you're able to perform it on your own. The next exercise is the straight leg raise. Still lying on your back with your surgical leg straightened,
and your opposite leg bent with the foot on the bed for support. Tighten your thigh muscles with a straight knee, lift up until you're about level with the other thigh. Then lower slowly down to the bed. Relax between each repetition of this exercise so that you have to re-straighten the knee before you start again. Oftentimes, people try to come down and immediately lift again. However, the knee tends to bend slightly. So relax, re-straighten the leg, and lift. Also, the tendency to raise the leg too high off the bed, which makes the exercise easier to perform, is something that people will do. So once again, relax, tighten the knee, raise the leg about equal with the other thigh, and then lower down slowly. If this exercise is too difficult to perform in the beginning, you can have someone help you lift the leg until you're able to do it on your own. The next exercise is the heel slide. Once again, lying on your back, both legs straight. Bend your surgical leg, sliding your heel along the bed toward your bottom until you have it bent as much as possible. Pause for a few seconds in the bent position before returning the leg to a straightened position. This exercise can be very difficult to perform in the beginning, so you can have someone help you by guiding the leg along until you can do it on your own. Also, a plastic bag or a cookie sheet below the foot can make sliding easier for you. Now we're going to review some stretching exercises. The first one will be knee straightening. Lying on the bed, place a pillow or a towel roll under your ankle so that your calf and thigh are lifted up off the bed. Allow the knee to relax and straighten fully. Hold this position for 1 minute, increasing the hanging stretch time as tolerated to 5 minutes. Try to avoid fighting or holding the leg, but really focus on letting it relax and straighten fully. It is common for the leg to hurt when coming out of this stretch, but that will improve once you let it relax and it's supported again on the bed. Another way to perform this exercise is to sit in a chair with the foot on another chair or a coffee table and have the calf and thigh unsupported, allowing the leg to hang down. For both versions of this exercise, both sitting and lying down, you can place a small weight on top of the leg, such as a bag of rice or beans, to assist with the downward straightening movement. In the beginning, it is typically best to start without this, but it can be helpful for increased straightening when you're able to tolerate it. The final exercise is knee flexion stretching, or bending of the knee. Sit in a firm chair with your thighs supported, feet on the floor, and we want to work to pull the foot back towards the chair, either using your muscles, or you can help lift the thigh with your hands to get additional bend. You can take the other leg to help and pull and get additional bend. And when you get it as far as you can, we want to let it sit and allow it to hold about 30 seconds. And then we'd let it out. Another way to get additional stretch is, once again, bring it as far as you can back towards the chair using one of those 3 methods. And once you get it as far as you can, keep your foot planted on the floor, but scoot your hips forward, which brings about a little bit more bend in the knee. Once again, allowing it to sit here for about 30 seconds before you get the leg a little bit of relief by letting it out. We want to do this for about 5 minutes. So in a 5-minute amount of time, you can usually do this exercise, 7 or 8 times, a 30-second hold. Once again, bringing it back as far as you can in one of those methods, shifting your hip forward to get a little stretch, and allowing it to sit and stretch for about 30 seconds. Both stretching exercises, straightening and bending, should be done 3 times a day for about 5 minutes. This is an example of how to elevate the leg after surgery. The foot is above the knee is above the hip, and the upper body is lying flat down so that the foot is above the level of the heart. You should be performing elevation of the leg multiple times per day in order to reduce swelling after surgery.